Well, this week we're highlighting the great work done by the United Way and their partner organizations. And today we're talking with the Mental Health Association Oklahoma to learn more about their mission and their work in the community. Joining us now live is their CEO, Terry White. Terry, thank you so much for being here.
Thank you for having me.
Of course, happy to have you here. We love highlighting great organizations in our community. So just right off the top here, kind of give us some insight and a look into what it is that the Mental Health Association does and your mission.
Sure. Mental Health Association Oklahoma is the state's premier boots on the ground nonprofit that really exists at the intersection of homelessness and mental illness. We fight every day to address mental illness, prevent suicide, end homelessness, and transform the criminal justice system.
Wow, you really do a lot, and these services are just so vital to our community. Give us a little bit more about the programs and the services that you do offer and how how you get this work done.
Absolutely. So we really exist at the when I say boots on the ground, I mean we are serving people that are off the grid, not connected to services. So when you see someone who might be on the street corner, tents under a bridge or along a highway, those homeless encampments, our staff is out making those connections, building trust, and helping create the bridge to bring people from chronic homelessness to housing. But not only to housing, but to the services that go with that, whether that's mental health, whether that's addiction, and most importantly, work. Work towards self-sufficiency is a huge part of what we do at Mental Health Association Oklahoma.
And that face-to-face human interaction just really makes all the difference in the world. So that's important, the boots on the ground. So I was reading on the website, your association helps tens of thousands of people. How have you seen the need for mental health services evolve over the years? Has there been an increase? Is it finally being more acceptable to talk about needing help?
The great news is we are breaking through a lot of stigma around mental health issues. We've made a lot of progress in that area. The unfortunate news is that the demand has never been higher. With the pandemic and what has happened in terms of lots of people losing employment, experiencing financial stress, the early stress, if you remember back to 2020 when we didn't know how long were we going to have to shelter in place, we saw a significant increase in both depression and anxiety, particularly among adults. It used to be 1 in 10 adults each year in Oklahoma. During the pandemic, that went to 3 out of every 10 adults. Not only that, but we've seen a significant increase in homelessness. We've seen more people on the streets than we've ever seen before, and so we've got to address this with more services. We have to make sure these programs are funded to meet the need because we know what to do. It's just how many Oklahomans can we reach?
Yeah, wow, and we definitely saw that need highlighted during the pandemic. You're right about that. Before we continue, Terry, I hate to do this. This is live TV. Can I have you move your hair just a little bit?
Sure, absolutely.
Sorry, we want to be able to share that we hear everything you're saying. It was just kind of rubbing against the microphone, but it's okay. We were able to hear. There were just a couple of times, and I just don't want any interruption to that. But continuing here, these services that you offer, they are so important. Can you give us a look into some of the impact that you've seen after you've worked with people?
Absolutely. Well, let's talk a little bit about what we do. We're really fortunate to be a proud partner of the United Way of Central Oklahoma. The United Way has a prestigious Wayfinder grant, and we were the recipient of the Wayfinder grant in both 2019 and 2020. In 2019, we were able to start Oklahoma City's first street outreach team. Street outreach is the team that I was mentioning that is out meeting people where they are, building trust, offering food, water, hygiene packs, and really being there when other systems have let people down so many times. So by utilizing our street outreach team, and then secondly, the 2020 Wayfinder grant started the Oklahoma City's first street medicine team. There are only 2 street medicine teams in the entire state. We operate one in Tulsa and one here in Oklahoma City. So I'll share a story of John. John was an individual who, it's hard to imagine with the hot weather we're experiencing right now, but if we think back to earlier in 2022, we had some really awful cold spells. Yeah. John lost 2 toes to frostbite because he was experiencing chronic homelessness. When our nurse from our street medicine team, Tim, found him on the street in the rain, he refused to go to the emergency room. Because we operate a street medicine team, Tim was able to see him for 2 times a week for the next 5 weeks and save his foot and his leg.
Oh, wow.
Without that, John would have lost his foot and his leg and potentially his life. So that's just one story of what we do when I say boots on the ground at Mental Health Association Oklahoma.
Wow, that is incredible. And who knows what would have happened, as you mentioned there, had your team not been there. That's just amazing, amazing work. Terry, if anybody's watching this and they know somebody who needs help or they need help, what do they need to know? What is the first step?
I think one of the most important things people need to know is that help is available. So reaching out, and hopefully you all will be sharing our contact information, that we have a number you can call if you need the street outreach team to come serve someone who's experiencing homelessness on the street that needs help. We also operate a mental health assistance center. That's a number that any Oklahoman can call who's having trouble navigating the mental health system. It's not the crisis or suicide hotline. That number that's being launched in the state is 988, and that's actually going to be a nationwide number where you call if you have a mental health crisis. But if you're having trouble accessing appointments or you're not sure if you need mental health help and you need a screening, call us at our Mental Health Assistance Center Monday through Friday, and we'll make those connections and we make those warm handoffs, and we stick and stay with people until they get to the services that they need.
Yeah, and that's important for people to know that the help is out there. That is the number one thing that we need to know. Is there anything else that your organization needs? Do you need volunteers? How can people help you with the work that you do?
Well, we're really lucky to have great partners like the United Way of Central Oklahoma and the City of Oklahoma City that provide us funding to do some of the programs we just discussed. We always need donations if people are able to donate. But it's not just money donations. As you said, we love to have volunteers. We operate housing. We house Oklahomans who are experiencing homelessness, and having things like welcome baskets when they get the keys to that apartment and they're able to step inside for the first time in years. A welcome basket that has towels and maybe a couple of pans for the kitchen and things like that. We have a host of opportunities for volunteers if they will reach out and connect with us.
Oh, I love that so much. A lot of things that we take for granted can really just mean the whole, makes such a big difference in somebody else's life. Terry, thank you so much for coming in with us and telling us all about Mental Health Association Oklahoma. The work you do is amazing. It is so needed and it is so appreciated. We thank you so much.
Thank you so much.